my name is Enos and welcome back to my channel. This is Work and Wonder. If this is your first time, please make sure you smash that subscription button and turn on the notification bell, and anytime I upload the video, you'll be notified and you'll come straight here and take a look at whatever the video is about. I talk a lot about the Mental Health Nursing OSCE, so if you are a mental health nurse who is preparing for his or her OSCE, then this is the right channel for you, because this is the only channel on YouTube that talks about the mental health nursing OSCE. So yes, I have a lot of videos on the mental health nursing OSCE, and anytime I see that there is a growing trend in either some kind of a failure in a station, then I'll quickly make a video on it so that people are aware of it and then they don't repeat those mistakes. So we are very much aware that from September there was some bit of a changes in terms of the skill stations. We know that the skill stations in the mental health nursing OSCE are 6, and out of these 6 you'll be given 4. Now there used to be suppository administration, which was one of the skill stations, which has been replaced by intramuscular injection. And lately, almost everybody is getting intramuscular injection. It's quite normal, because if there is an introduction of a new skill, then probably they will want to test it out and see how efficient it is. So I'm not surprised that almost everybody that goes might or is getting the IM injection as one of their skill station. But then people are also failing, and it is just some petty things that are making them fail. It's not that they are not able to do it, but then it's just some 1 or 2 things that is making them fail. For me, I always wish that everybody that's preparing for these exams will go into the exams and then just pass on one attempt. But we all know that sometimes anxieties and stress and everything set in exam situation can change the whole narrative. It doesn't matter how prepared you are, just the slightest of mistakes and then you would fail. So there are about 3 things with regards to the IM that about 3 people or 4 people have failed, and it's almost the same thing. So I've decided to make a video about it, and they are just petty things that just that probably because they were under stress they forgot, and because of that they failed. The very first thing has got to do with changing of the needle. So this is my syringe, this is my needle. Anytime you are doing IM or intramuscular injection, you use 2 needles. The very first one is for withdrawing the medication, and then the second one is for injecting. We all know that the selection of the needle is basically based on the site of injection, whether it is the deltoid, whether it is the vastus lateralis, which is on the thigh, or whether it is the gluteal or the bum muscle. And usually we know that the bum muscle contains or is a bit thicker than the one you find here. So you have to make sure that you appropriately select your needle that you are going to use, and please make sure that the needle that you use for withdrawing the medication from either the ampoule or the vial, you make sure that that is not the same needle that you are going to use for the injection. So that's the very first thing. Some of them are getting their reports and they're like, they did not change their needle. Yes, it could be this, but it could be that you are under stress and then you forgot to change it. So please keep this at the back of your mind. Always make sure that you change the needle, and then of course you replace it with a new one that you are going to use for the injection. That's the very first thing that people are failing for. Now, the second thing has got to do with the technique of injecting. And I know very well that people are tempted not to use the correct technique, probably because of the assumption that, for example, if it is a deltoid muscle, people are fond of going that way and they think that that is the right thing. It is clearly stated that in IM injections, you go in 90 degrees. And you know that you'll be given something like this for you to inject for them to see. So if you are giving something like this, this is 90 degrees. So it goes perpendicular to the skin. So if you are injecting, please make sure you go in 90 degrees. So this is your 90 degrees. You are not going in this way, neither are you going in that way, or you are not bending the injection or the needle this way, if you bend it, this is not a 90-degree angle. This could be 35, this could be 60, this could be 70. 90 is straight away, it is perpendicular to the skin. So the skin is on a flat surface, and then you are going in 90 degrees. So this is another thing that is failing people. People are going in either this way, or they are going in that way, or they are going in that way, or they are going in that way. Please make sure your needle is perpendicular to the skin, which is 90 degrees. So the technique of the needle going in is one of the things that is failing people. Then the third thing is people are pushing the needle all the way to touch the skin, which shouldn't be the case. If you go in this way and the needle breaks, how do you get the needle out? So the idea of you leaving at least 1 centimeter this way, so you can see that you can still see the needle. The idea of you going in and leaving 1 centimeter is, in case it breaks, there is still something you can hold on to, and then you pull out. But if you go all the way this way and it is touching the skin and it breaks, then what becomes the fate of the person? That needle is stuck inside. So please make sure that after going in perpendicular 90 degrees, make sure that you leave at least 1 centimeter of the needle, so that in case it breaks, you will be able to pull it out. So that is the third thing. Make sure you leave at least 1 centimeter of the needle before when you are injecting, so that in case it breaks, you are able to quickly pull it out. Then the last thing is the recapping of the needle. Once you are done, once you take it out, please make sure this is going into the clinical sharp bin. Just go straight, just put it straight into the clinical sharp bin. Don't be tempted to recap it. In recapping, you can prick yourself. In recapping, you can prick yourself. So please do not recap. This is something that has failed more than 2 or 3 people. Once they were done, they were tempted to recap the needle. Once you are done, straight away, the clinical sharp bin, this goes into it. Don't make that mistake of recapping. So that is the 4th mistake that people have been making, and then they are failing. So please take note of it. And I think something that also failed someone is the inspection of the site. Before you give an injection, of course, you have to look at the site of injection to make sure that the site is good for you to inject. So for example, I'm going to inject the deltoid, and then I went to the place and I saw that there's a wound there. So far as there's a wound there, I wouldn't be injecting into the wound. So I have to inspect the site to make sure that the place is clean, there are no excoriations, there are no wounds. There's not anything that will prevent me from using that particular site that I have selected or per the scenario to give my injection. So that is one thing that you should also take note of. These are the things that are failing people. So as you can see, it's not that they are not or they don't know what they are doing, but because of 1 or 2, maybe exams pressure, because of that, they were not able to do these things and they failed for that reason. So please make sure that if you are going into your exams, have this at the back of your mind, whether you are getting IM or not. But then if you are getting IM, have this at the back of your mind so that you wouldn't repeat these mistakes that people are making and they are failing the exams. So that is all for the video. As you have come here to watch this video, I'm going to give you a scenario, and in the link you are going to find a Google Drive link where you can have access to this particular scenario, and it's a scenario for IM. As you can see on your screen, it states that you are a mental health nurse working in the community clinic. Mrs. Blessing has arrived for her scheduled weekly intramuscular injection as part of her ongoing treatment. Administer the IM safely using the proper aseptic technique. You have 12 minutes to complete this station, including the administration of the injection and all necessary documentation. Assume it is 700 hours. And if you go through it, you can see that we have the very first part of it, which has the biodata of the patient. Then the second one has got to do with the doctor. The third one has got to do with those administering the medication. Then we have the allergy part of it, which you can also see here. And then We also have, when you come down, the next page talks about the coding. Then when you come here, we have the medication, which is the day, which is today. Then we have the drug, which is paliperidone. And then we have the dosage, which is the delta. We have the dosage, which is 75 milligrams. The route is a deltoid. Then the time is 7 o'clock. And then the frequency is weekly. The end day is today. And of course, the prescriber's name, Dr. Strange, and the date is today. And of course, this is where you are going to sign if you give the medication, which is given by sign date and then the time. So basically that is a prescription. And then of course when you come to the bottom part, you also have omitted doses. If you are omitting any medication, this is where you normally also record it. So this is a prescription or a scenario that I'm giving you for free. Just go to the description and then you can find it there, and you can use that to practice for your IM injection. My name is Enos and this is Work and Wonder. Please make sure you subscribe to the channel if you have not, and then try as much as possible to share to other people that you know that they are preparing for their OSCE exams. There's also going to be a link there if you want my API booklet, which consists of assessment, scenarios, planning, which I have drafted a care plan already, implementation, there are scenarios, and then of course evaluation as well. Just click on the link. It's going to send you to another place where you can also have access to it, and then you can practice with us as part of your preparation towards your mental health OSCE. Those that are preparing for their mental health OSCE in December, I wish you all the best, and then continue watching the videos and share to other people so that they can also have access to these incredible videos that I spend a lot of time creating for you. Until I see you in my next video, it is a bye for now.